Welcome back! If you're new here, this channel is dedicated to real, practical health information for adults over 60. No gimmicks, no miracle creams that cost $80 and smell like a department store. Just honest guidance you can use starting today. Now, loose neck skin, sagging jowls. That soft pouch some people call a waddle. Whatever name you give it, the frustration is the same. You look in photographs and barely recognize yourself. You avoid certain angles. Maybe you've started wearing scarves and turtlenecks even when the weather doesn't call for them. And somewhere in the back of your mind, there's a quiet voice saying, "Well, I'm just old now. Nothing I can do." That voice is wrong. Let me be clear. I'm not promising you'll wake up looking 35. But the skin on your neck and along your jawline responds to very specific inputs: nutrition, hydration, targeted movement, certain topical ingredients that actually have clinical evidence behind them, and a handful of professional treatments that don't require going under anesthesia. The problem is, most of the advice floating around online is designed for people in their 20s and 30s. Their skin is a completely different animal. What works for a 28-year-old influencer will do absolutely nothing for someone whose collagen production slowed down 2 decades ago. So today, everything we cover is tailored specifically for mature skin. Your skin. Let's get into it. Before we talk about tightening, you need to understand what's actually loosening, because the answer might surprise you. Most people assume sagging skin is purely a surface problem, like the skin itself just stretched out, the way an old rubber band loses its snap. That's partially true, but there's a whole architecture underneath your skin that's collapsing at the same time. Think of your neck and jawline like a house. The skin is the paint on the outside. But beneath it, you've got framing. That's your collagen and elastin, two proteins that act like scaffolding. Collagen gives skin its firmness. Elastin gives it bounce, that ability to spring back when you press it. After age 60, your body produces roughly 75% less collagen than it did in your 20s. Elastin production has slowed even further. So the scaffolding is thinning out and the paint on the outside starts to sag and wrinkle because there's nothing holding it up from behind. But that's still not the full picture. Underneath the collagen layer, you have a thin sheet of muscle called the platysma. It runs from your chest all the way up over your jawline. When you were younger, this muscle was taut, like a drum skin pulled tight. As decades pass, the platysma loosens and separates into two vertical bands. You might have noticed those, two cord-like ridges running down the front of your neck. That separation creates slack, and the skin draped over that muscle follows it downward. Then there's fat redistribution. The fat pads that once sat high along your cheekbones and jaw gradually migrate south. They pool beneath the chin and along the jawline, creating that heavy, soft look we associate with jowls. And finally, bone loss. Most people have no idea this plays a role. After 60, the bones in your face actually shrink. Your jaw recedes slightly, your chin loses projection. When the bony foundation gets smaller but the skin stays the same size, you end up with excess fabric, so to speak, with nowhere to go but down. So when you look at turkey neck, you're really seeing 4 problems happening simultaneously: collagen loss, muscle laxity, fat migration, and bone resorption. Understanding that is important because it tells us we need a multi-angle approach. No single trick handles all 4. Let's start with what you can do right now, today, for free, sitting wherever you are. Neck and jaw exercises get a lot of skepticism, and honestly, some of that skepticism is fair. You're not going to exercise your way to a facelift, but remember that platysma muscle we talked about? It responds to resistance and repetition the same way your biceps or your thigh muscles do. Strengthening it creates a subtle lifting effect and improves the underlying tone beneath loose skin. Here are 4 exercises backed by dermatological and physiotherapy research. Do each one slowly. This isn't a race. Controlled movement is everything. Exercise 1. The chin press. Sit upright in a chair with your shoulders relaxed and pulled slightly back. Tilt your head toward the ceiling until you're looking straight up. Keep your lips closed. Now press your tongue firmly against the roof of your mouth and hold it there for 10 seconds. You should feel a contraction deep under your chin, almost like a cramp forming in the floor of your mouth. That's the mylohyoid and the anterior belly of the digastric, small muscles that support the area directly beneath your jaw. Release slowly. Repeat 8 to 10 times. Do this twice a day. Exercise 2. The jaw scoop. Tilt your head back again, looking upward. Now jut your lower jaw forward, as though you're trying to scoop something off a high shelf with your bottom teeth. Hold for 5 seconds. You'll feel a deep stretch along both sides of your neck and underneath the chin. Return to neutral. Repeat 10 times. This targets the platysma directly and also engages the muscles along the front of the throat. Exercise 3. The resistance press. Make a fist and place it directly under your chin. Now try to open your mouth downward while your fist resists the movement. Push against your own fist for 8 seconds. Release. Repeat 8 times. This creates isometric tension. Your muscles are working hard without actually moving through a range of motion, and it's one of the most effective ways to build tone in smaller muscle groups without straining your neck or spine. Exercise 4. The wide smile hold. This one works the jowl area. Clench your teeth gently together, then stretch your lips into the widest smile you possibly can. Hold for 10 seconds. You should feel the muscles along the sides of your neck pulling taut, almost like cables tightening. Release. Repeat 12 times. This particular movement engages the risorius and the lower fibers of the platysma simultaneously, which addresses that soft area where the jawline meets the neck. Now, how quickly do these work? Consistency matters far more than intensity. Most people who perform these exercises twice daily report noticeable improvement in neck firmness within 4 to 6 weeks. Photographs taken in the same lighting at the same angle will show the difference more reliably than what you see casually in the mirror. A word of caution: if you have cervical spine issues, arthritis in your neck, a history of herniated discs, chronic neck pain, skip the exercises that involve tilting your head far back. Modify them by keeping your head in a neutral position and focusing on the jaw and tongue movements only. Your safety matters more than aesthetics, every single time. Here's where most advice falls short. People focus entirely on what they put on their skin and completely ignore what they put inside their bodies. But your skin is an organ, the largest one you have, and it rebuilds itself using raw materials delivered through your bloodstream. Let's talk about collagen first. Your body builds collagen from amino acids, primarily glycine, proline, and hydroxyproline. These come from protein-rich foods. If your diet is light on protein, your body simply doesn't have the building blocks to maintain what little collagen production remains after 60. Good sources include bone broth, which delivers collagen in a form that's already partially broken down and easier to absorb. Chicken thighs with the skin on, sardines and salmon, where you're eating the smaller bones and connective tissue. Eggs, particularly the whites. And if chewing tough meats is difficult, slow-cooked stews and soups are a perfect alternative. The long cooking time breaks protein down into softer, more digestible form while preserving the amino acid content. Collagen supplements have gained enormous popularity, and the research is actually encouraging. A 2019 review published in the Journal of Drugs in Dermatology analyzed 11 studies involving over 800 patients and found that supplementing with hydrolyzed collagen peptides, usually 5 to 10 grams daily, improved skin elasticity and hydration within 8 weeks. Look for supplements that list hydrolyzed collagen peptides or collagen hydrolysate on the label. Powder forms mixed into coffee, tea, or soup tend to absorb well and are easier on sensitive stomachs than large capsules. Vitamin C is the next critical piece. Your body cannot synthesize collagen without it. Vitamin C acts as a cofactor in the enzymatic reaction that assembles collagen fibers. Bell peppers, strawberries, kiwi, broccoli, and citrus fruits are all excellent sources. If you're taking a supplement, 200 to 500 milligrams daily is sufficient. More isn't necessarily better, and very high doses can cause digestive upset. Omega-3 fatty acids deserve a mention because they maintain the lipid barrier in your skin, that thin fatty layer that locks moisture in and keeps irritants out. When this barrier weakens, skin looks creepy and papery almost overnight. 2 servings of fatty fish per week, or a quality fish oil supplement providing at least 1,000 milligrams of combined EPA and DHA, supports this barrier effectively. And hydration. This sounds painfully simple, but dehydrated skin sags more dramatically than hydrated skin. After 60, your thirst sensation diminishes. Your brain doesn't signal drink water as urgently as it once did. Many seniors walk around mildly dehydrated without realizing it. Aim for 6 to 8 glasses of water daily. Herbal teas count, broths count. If plain water bores you, adding sliced cucumber, a few mint leaves, or a squeeze of lemon makes it far more appealing. One more nutritional note: reduce refined sugar intake where you can. Sugar molecules attach to collagen fibers through a process called glycation, which stiffens and weakens them. Think of it like rust forming on metal beams. The collagen doesn't just break down, it becomes brittle and malformed. Reducing desserts, sweetened beverages, and white bread won't reverse existing glycation, but it slows the ongoing damage significantly. If you're over 60, or you're caring for an elderly parent, a spouse, a loved one, this information matters more than you might think. Skin health reflects overall health. The same collagen loss that shows up in your neck is happening in your joints, your bones, your blood vessels. Taking care of your skin from the inside out means you're taking care of everything else at the same time. So if this is resonating with you, consider sharing this video with someone who needs to hear it. A quick text to your daughter, your neighbor, your walking buddy. You never know who's been silently frustrated by the same mirror. Walk into any drugstore and you'll find 300 products claiming to firm, lift, and tighten neck skin. Most of them are expensive moisturizers with fancy packaging and negligible active ingredients. Let's cut through the noise and talk about what dermatological research actually supports. Retinol. This is the gold standard. Retinol is a derivative of vitamin A, and it's one of the only topical ingredients proven to stimulate collagen production in the deeper layers of skin. It increases cell turnover, thickens the dermis over time, and improves texture and firmness. For mature skin, start with a low concentration, 0.25%, and apply it to your neck every other night. After 2 weeks with no irritation, move to nightly use. After a month, you can consider stepping up to 0.5%. Always apply retinol at night because it breaks down in sunlight. And always follow it with a rich moisturizer because retinol can be drying, and dry skin on the neck creases and sags faster. One critical warning: retinol makes your skin significantly more sensitive to UV radiation. If you're using retinol on your neck and not applying sunscreen there during the day, you're actually accelerating damage, which brings us to the next ingredient: broad-spectrum sunscreen, SPF 30 or higher. Ultraviolet radiation is responsible for up to 80% of visible skin aging. 80%. The wrinkles, the sagging, the crepey texture, the vast majority of it comes from cumulative sun exposure, not simply from getting older. Most people apply sunscreen to their face and completely forget their neck and chest. The skin on your neck has been absorbing UV damage for 6, 7, 8 decades with minimal protection. Going forward, apply a broad-spectrum SPF 30 or higher to your neck and upper chest every single morning, even on cloudy days, even in winter. This one habit alone will slow further collagen degradation more than almost anything else on this list. Peptide serums. Peptides are short chains of amino acids that act as chemical messengers. When applied topically, certain peptides signal your skin cells to ramp up collagen and elastin production. Look for products containing palmitoyl tripeptide, palmitoyl tetrapeptide, or copper peptides. These won't produce dramatic overnight results, but over 8 to 12 weeks of consistent use, they contribute to measurable improvement in skin density and firmness. Apply peptide serums after cleansing and before moisturizer, both morning and night. Hyaluronic acid. This molecule holds up to 1,000 times its weight in water. Applied topically, it draws moisture into the upper layers of skin, creating a temporary plumping effect that reduces the appearance of fine lines and creepiness on the neck. It doesn't tighten skin structurally, but the visual improvement is real and immediate. Look for serums that combine low molecular weight and high molecular weight hyaluronic acid for penetration at multiple depths. Apply to slightly damp skin. Mist your neck lightly with water first, then apply the serum. This gives the hyaluronic acid the moisture it needs to grab onto. Niacinamide. Also known as vitamin B3, niacinamide strengthens the skin's moisture barrier, reduces redness, and has been shown to improve elasticity over time. Concentrations between 2 and 5% are well tolerated by mature skin and pair nicely with hyaluronic acid and peptides. It's gentle enough for daily use, morning and evening. A practical layering order for your neck at night: cleanser, peptide serum, hyaluronic acid on damp skin, retinol, then a thick moisturizer to seal everything in. In the morning, cleanser, peptide serum, hyaluronic acid, niacinamide, moisturizer, sunscreen. Sounds like a lot of steps, but once it's habit, the whole routine takes under 3 minutes. For those who want to go beyond home care, several non-surgical professional treatments have strong evidence for neck tightening in mature patients. Ultrasound therapy, commonly branded as Ultherapy. This device delivers focused ultrasound energy deep beneath the skin, targeting the same muscular layer that a surgical facelift would address. The heat stimulates a wound healing response, and over 2 to 3 months, new collagen forms along the treated area. Most patients need 1 session, occasionally 2. Discomfort ranges from mild to moderate. Many describe it as a hot, prickling sensation. Results develop gradually and peak around 3 to 6 months after treatment. Clinical studies show measurable lifting along the jawline and neck in approximately 60 to 70% of patients over 60. Radiofrequency treatments, brands like Thermage or Morpheus 8. These use radiofrequency energy to heat the deeper dermal layers, causing existing collagen fibers to contract and tighten while stimulating new collagen growth. Morpheus combines radiofrequency with microneedling, which creates tiny channels in the skin that also trigger a repair response. A typical protocol involves 2 to 3 sessions spaced 4 to 6 weeks apart. Downtime is minimal, redness and mild swelling for a day or 2. Results build over several months. Microcurrent therapy. This is a gentler option. Low-level electrical currents stimulate the facial and neck muscles, essentially giving them a workout from the outside. Think of it as a complement to the exercises we discussed earlier. Professional microcurrent sessions performed weekly for 6 to 8 weeks have been shown to improve muscle tone and reduce sagging. Home microcurrent devices exist as well. The New Face brand is among the most studied, and while they're less powerful than professional units, daily use over several months does produce visible firming in many users. Chemical peels and laser resurfacing. These treatments remove damaged outer layers of skin and stimulate regeneration from beneath. For neck skin specifically, medium-depth peels using trichloroacetic acid or fractional laser treatments can improve texture, reduce crepiness, and modestly tighten lax skin. These are best performed by a board-certified dermatologist experienced in treating mature skin, because older skin heals more slowly and is more susceptible to pigmentation changes if the treatment is too aggressive. A realistic conversation with yourself. Professional treatments are investments. They range from several hundred to several $1,000s per session, and most are not covered by insurance. They produce real results, but they won't replicate a surgical neck lift. Think of them as turning the clock back 3 to 7 years, not 20. Combined with the home care, nutrition, and exercise strategies we've already discussed, the cumulative effect can be genuinely remarkable. Before we wrap up, let's address some everyday habits that quietly make turkey neck worse. Eliminating even 1 or 2 of these can slow the progression noticeably. Tech neck. Looking down at a phone, tablet, or laptop for hours creates deep horizontal creases across the front of your neck and trains the skin to fold forward, Hold devices at eye level whenever possible. If you're reading on a tablet, prop it on a stand or a stack of books so your chin stays neutral. Sleeping position. Side sleepers and stomach sleepers compress neck skin against the pillow for 6 to 8 hours every night. Over years, this contributes to asymmetric creasing and accelerated laxity on the side you favor. Sleeping on your back with a supportive pillow keeps the neck skin smooth and uncompressed. If you can't sleep on your back, a silk or satin pillowcase reduces friction and creasing compared to cotton. Smoking and excessive alcohol. Smoking destroys collagen and elastin at an accelerated rate and restricts blood flow to the skin, starving it of oxygen and nutrients. If you still smoke, this is one more powerful reason to pursue cessation. Alcohol dehydrates the body and skin, dilates blood vessels, and interferes with the deep sleep phases when your body performs the majority of its tissue repair. Reducing alcohol intake to occasional and moderate use directly benefits skin quality. Neglecting the neck during skincare. Many people have a meticulous facial skincare routine that stops abruptly at the jawline. Your neck skin is thinner, has fewer oil glands, and receives more sun exposure than your face. It needs equal, arguably greater attention. Every product you apply to your face should continue down your neck and onto your upper chest. Let's bring this all together. Turkey neck happens because of collagen loss, muscle laxity, fat migration, and bone changes. Addressing it requires working on multiple fronts simultaneously. Targeted exercises strengthen the underlying platysma and supporting muscles. Proper nutrition, adequate protein, collagen peptides, vitamin C, omega-3 fatty acids, and consistent hydration provides your body with the raw materials to maintain and rebuild skin structure from the inside. Proven topical ingredients like retinol, sunscreen, peptides, hyaluronic acid, and niacinamide protect and stimulate the skin's outer layers. Professional treatments can amplify all of these efforts for those who want accelerated results. And eliminating damaging daily habits, tech neck posture, sleeping position, smoking, sun exposure without protection, prevents you from undermining your own progress. None of this requires perfection. You don't have to do every single thing on this list starting tomorrow morning. Pick 2 or 3 strategies that feel manageable. Build them into your routine. Add more when those feel automatic. Consistency over intensity. That's the principle that actually changes skin. You have spent your entire life earning that face. The lines around your eyes? Those come from decades of laughter, of squinting into bright sunlight at your children's soccer games, of reading late into the night. You deserve to look in the mirror and feel good about what you see. Not because wrinkles are shameful, they aren't, but because taking care of yourself is a form of respect, self-respect, and you deserve every ounce of it. If this video helped you, if even one piece of information felt new or useful, hit that subscribe button so you don't miss what's coming next. We cover real health strategies for real adults living real lives past 60 every single week. Drop a comment below and tell me, which tip are you going to try first? The exercises, the nutrition changes, a new skincare step? I read every comment, and I genuinely want to know. And please, share this with someone who needs it. Text it to a friend. Send the link to your group chat. Knowledge only works when it reaches the people who can use it. Take care of yourselves. I'll see you in the next one.